Everybody knows this scratch collapse test. It is a temporarily voluntary loss of contracture. Scratching over the area of the nerve compression causes temporary loss in voluntary muscle contraction. In Sanskrit called lift, which is analog to the elevator. So during passive supination, compression of the PIN produces the sudden escalation of the pain, indicating the positive test. This is two-stage side-to-side comparative RTS stages. First is passive reproduction. Supination produces the pain. You can see on the face. Then shoulder elevation intensifies the symptoms, and mid-prone relieves the pain. Passive supination. This is the schematic diagram. This is first no pain, no irritating pain. She is comfortable. Now this is abnormal side. See on the face. When I do supination, there is a pain, and she is pointing out with the finger. It is going to the neck. When I lift, pain aggravates. And when I do mid-prone, pain goes. Other tests: rule of 9, middle extension, finger extension test, investigation, X-ray no value, EMG showing nothing, dynamic sonography which I have developed, above the supinator edge, at the supinator edge, and below supinator edge in supination, mid-prone and pronation. So it shows a dynamic study. So if you see in this dynamic USG, you can see from supination to pronation, nerve gets compressed. Conservative treatment, NSAID never works in RTS. Then Tadasana sometimes benefits. Okay, so this is the classical band of Fontana. Everybody knows this. But if there is a chronic RTS compression, it looks like a impression of the supinator muscle, which I called as the snake's skin. So clinical tried post-operatively, tenderness subsides, gain power, and scratch collapse test negative. This is ECU, same patient. Previously it was not there. It's good power. This scratch collapse test. And this is operative side. Diagnosis: how will you differentiate between radial tunnel versus misdiagnosed? It is not diagnosed. I think everybody agrees that the first compression in your practice, you see always carpal tunnel.